Okay. Pilonidal cyst, also known as Jeep driver disease, was common during the World War. Many of the Army vets would come back and have inflammation at the tailbone. There's different theories as to why it happens. We don't really know, though there is a board answer, but even that is a contention. What we do know is that there is hair that is down in the tailbone region. It gets impacted within its follicle and causes an inflammatory cycle, which then cavitates and forms into a cyst. Ultimately, it's that inflammatory process that forms a capsule, and that capsule that makes it a chronic condition and needs to be addressed to be able to alleviate the symptoms. I'm Dr. Kamrava. I'm a dual board certified general and colorectal surgeon. What makes me a pilonidal expert in training, really the same as any other colorectal surgeon. We're all trained and board tested to ensure that we know the most advanced techniques and treatment modalities for pilonidal cysts. But I'm one who has made a practice and has focused my practice on treating it on a day in, day out basis and bringing all the best treatments to hand and giving those options to my patients to decide what is the best path forward for them. Pilonidal cysts in general are dealt with by colon and rectal surgeons. Why? We may not know why. The original pilonidal surgery was done by general surgeons, and then as there was difficulties with the wound and these more advanced techniques to flap closure and handle these, the specialty of colorectal adopted it into their rubric of teaching. It's in the textbook as its own chapter, and it's part of our board examination as a specialty. The advanced flap techniques are something that we expect our fellows to be trained in, and they are things that are in many ways taken from the field of plastic surgery, but specific to this disease. Part of the reason that pilonidal cyst has fallen under the realm of the colon and rectal surgeon is that in rare cases, pilonidal cyst can mimic, be linked to, or act like some other rare diseases that we deal with. And if it is in those cases, those diseases, they definitely fall under the field of colon and rectal surgery due to their involvement of the rectum or the area around that. And being able to differentiate and then act upon that information is very critical. And for this, in putting those pieces together, it came to be a disease that by and large gets treated by physicians who are otherwise surgeons that treat cancer of the intestinal tract. A common question we get is hygiene related to the extent of severity of the inflammation of a pilonidal cyst. Some would argue yes, some would no. Honestly, there's no definitive clear answer, but we do know that hygiene is better when it's good. Is it related? Likely yes, and we typically will tell patients to maintain good hygiene for a multitude of reasons, this also being one of them, because we do know that there are pits on the tailbone that are connected to a pilonidal cyst, and if dirt and sweat and what other type of material can track into there, then it would affect the cyst. So do you have a pilonidal cyst or is it something else? Typically, and in the body, we often say common things being common, this being one of them. If you have what seems like a large pimple that recurs on some type of cyclical basis, for some people it's every couple weeks, others it's every few months, but it follows a typical pattern cycle, and it's in the area of the tailbone, or at what others would say the top of the buttocks. More than likely it's a pilonidal cyst, though there are some more atypical things that could present like this as well. But typically when we see a cyst at the top of the buttocks or at the tailbone, more than likely it's a pilonidal cyst, and there's other things that we as surgeons and physicians will check to rule out to make sure it is not. A common question we get, are pilonidal cysts life-threatening? Essentially no, though again, in medicine there are no absolutes. Everything is a generality. But it should never be something that you think you have to have surgery because it's a fear of life. The decision to operate on a pilonidal cyst to treat it is a lifestyle choice. Is it impacting your daily activities? Is it impacting your ability to live life? Then that's something to consider. There are many patients who have pilonidal cysts that do not inflame, they do not infect, and they never cause a problem. They're just there. And if that is the case, typically I would tell patients and recommend to them, do not do anything at all, because the risks of treatment, albeit small, are actually going to outweigh the risks of the cyst itself to you. If, however, your cyst is inflaming and causing issues where you're constantly having to have interventions or taking time off work or can't sit comfortably on a meaningful basis, that's when it's worth considering if you should have treatment. Every so often, some physicians will say you have to have treatment. That is never the case. Everything should be tailored to your particular need. The risk for cancer is more of a theoretical risk. In the body in general, if you have a chronic smoldering wound, those wounds can, over many, many years, turn into cancer. And that's a generic statement about any type of wound. But if you have a cyst that is non-inflamed, then it doesn't really fall into that category. And so using it as a decision for treatment or not, that risk for cancer is not necessarily the case. Typical symptoms for a pilonidal cyst are infection at the skin level. Will you have a systemic or a whole body response? It really depends on the severity of that infection. Generally speaking, no, but there are individuals where the infection is so large that they will feel it throughout their whole body. It will become more of a generalized response. Not in the sense of sepsis, where you get very sick and end up in an ICU and it's a life-threatening situation, but just that you're feverish or you feel a general sense of malaise or just not feeling strong or 100%. More commonly, though, pilonidal cysts are a localized infection at the skin level and shouldn't affect the entire body as a whole. A common question we get are at-home remedies to treat pilonidal cysts. It depends how you want to actually phrase that. The question is, as I stated, how can I treat this at home? And the word treat is a difficult one because there really aren't any recognized at-home remedies to treat a pilonidal cyst in the sense that you would cure it. That being said, there's much you can do. If you notice you have a pilonidal cyst that is inflamed and swollen, looks like it's actively infected, typically what you need to do is get that pus that's inside and underneath the skin out. Sometimes that needs to be done with a physician where we lance it or do an incision and drainage. Those incision and drainages are specifically only to treat the active infection. They will not cure the pilonidal cyst, but really focused on you are actively infected, let's get you uninfected, and then we will address the cyst later. For some patients and some people, when a cyst is actively infected, they can place a warm compress over that area, over the tailbone, and leave it there for 15-20 minutes, or maybe soak in a warm bath. And the skin will soften enough that it will self-express itself. And as long as you're able to meaningfully get that pus out, that's the most important thing when it's actively infected. Aside from that, general hygiene, as discussed, is typically considered to be an important part. Some people will recommend using laser hair removal or shaving the area in general. If it's efficacious and actually changes the outcome or the long-term severity of a pilonidal cyst is actually still in question. We're looking into that. No clear evidence is shown either way or not, but we do know it doesn't hurt. So if you're considering getting laser hair removal or shaving the area, we say why not, but I wouldn't give it as a strong recommendation to do so. We don't really know the root cause for pilonidal cysts. There's different theories that abound. There's one that is the board answer, but even that is in contention. All we do know is that hair somehow impacts underneath the skin. It gets impacted at the follicle level and starts a cavitation process through that infection, which then becomes larger and larger and incorporates other hair follicles within it. Some measures that have been considered to potentially limit your risk of a pilonidal cyst is hair removal in that area, in the tailbone area. The truth is we don't really know if it will make that go away because what's happening with a pilonidal cyst is at the root level. And so if you shave the area, shaving doesn't affect the root level of a pilonidal cyst, or a hair follicle to be precise. Will laser hair do that? Laser hair does go to the root level, but is it effective at preventing a pilonidal cyst? The evidence still isn't there. Evidence isn't there that it doesn't help necessarily, but we don't have clear evidence that it does. And so the one thing you could potentially do that maybe, and I stress maybe, may decrease the risk of getting a pilonidal cyst is hair removal in that area, especially if you have a hairy background within yourself or your family, or you have other family members, be it siblings or parents, that have had a pilonidal cyst, and say, I will proactively get that area treated with hair removal. Maybe then, without evidence, could I say that may help, but there's no clear thing that we know that could help prevent this happening for patients that it does happen. You can find me online at drkamrava.com, link below. And you could even book an appointment online. If you're from out of state, you could also book virtual appointments, and we could figure out together what would be the best course of therapy that fits your lifestyle and your needs.